Hey everyone, this is Britt from motherhoodalliance.com, and I'm excited to bring you a special 4-episode series with husband and wife team, Doctors Julie and Skip Wyss from Prime Family Chiropractic Centers. Both are doctors of chiropractic who specialize in pregnancy, pediatric, and family care. Interestingly, when they were in chiropractic school, they originally planned to do work with athletes, especially being so close to Green Bay, but life took them in a different direction, and we'll talk a little bit more about that in episode 1. They got married during grad school, found out they were expecting shortly after, and were mentored by a coach who ran one of the largest pediatric chiropractic offices in Canada, which I understand helped shape the focus of your practice today. Today, they're passionate about helping families take a more proactive approach to health by giving parents a supportive, judgment-free space to ask questions and make informed decisions for their kids. They're also raising 2 kids of their own, along with 2 French Bulldog puppies, so they definitely understand the real-life chaos and joy of family life. Julie and Skip, we're so glad you're here.
Thanks for having us, Brittany.
Thank you for having us.
All right, we are back with episode 2. Welcome back, Doctors Julie and Skip.
Good morning.
Thanks for having us.
Yes, we are excited to be back. If you guys listening did not listen to our first episode, hit pause right now. Go back and listen to that one. We talked all about why are kids always sick these days. And honestly, it applies to adults too. So really, everybody will gain benefit from that episode. Head back, listen to that one, and then jump into this one. Today, we're talking about constipation too. This is also a chronic issue, not just in kids, but also adults. I think we're going to be a little bit more kid focused, but those adults in your life who are struggling with this will probably get some applicable things as well from this episode. So let's just start with, the very basic elephant in the room question. Why is constipation so common nowadays, especially in kids?
Number one, adults are just really big children, especially if you have a man in your life. We don't grow up past 12. You just don't.
Are you talking about bowel movement wise or in general?
I think
in general, both.
I think both. Like, when did Brecken start finding farts funny? 4?
Yeah, probably.
Yeah, and if you look at like me and his feed back and forth, there are usually a lot of fart videos. So
That was so funny.
Ridiculously funny. Constipation is extremely high. Now, what I'd like to say is that bowel disorders are probably in 80% of the patient population that we see. 50% are constipated, and the other 50% have diarrhea. So they kind of go hand in hand. So not to just go and 180 you right away, but constipation and diarrhea go hand in hand. And either you're going too much or you're going too little, and most people aren't going consistently enough to even know what a normal bowel movement is, let alone a child.
I did not realize the diarrhea side was that high.
Yeah, it is. It is because every time, so let's look at it from a baby's perspective. So when you have a newborn, right, they're either having blowouts and it's like going to their shoulder blades, which is hilarious, okay? Or they're constipated, or they shart. So typically, parents will concentrate on constipation in children all the time. If there's a shart in there every time, your kid's suffering from diarrhea. Either that or they're so badly constipated that they're leaking around the bolus of bowel material, of crap that's stuck in them, and they're leaking, which is what happens too.
Okay. So whether you're on the constipated side or the loose side, why? What is the cause of so much bowel dysfunction?
If we're talking about kids, it comes back to the birth process is a big part of it, but all these babies are in diapers, right? So we have this video for a reason. When we are constantly bringing our kids up and we're folding their legs back, right? Because, after maybe the first one, we're a little bit more gentle when we
You shouldn't change your kid like that.
When we pull the baby's legs up, right? We're a little bit more gentle, but every time we do that, that puts pressure on the low back, that puts pressure on the sacrum. And that movement, again, those nerves are what control the bowels and the bladder. So if we're constantly disrupting that area, then we are disrupting the communication from the sphincters, the poop, the bowels, the bladder to the brain. And so again, that it's subluxation. And so when we're subluxated down there, that doesn't allow the colon to fully void, or it only does a little bit or every so once in a while.
What is the proper way to change a diaper?
I'd roll them. So instead of using their legs as a fulcrum and pull their butt up like this, you roll them to one side, clean them out, take the dirty diaper out, get their butt cheeks clean on the back really well, roll them then over the clean diaper this way, clean them out, and then lay them right back on top. And if you've ever tried to change a 6-month-old that can actually move, they want to roll anyways.
Huh.
They're always rolling. Every parent that's changed a diaper knows that as soon as the child knows how to roll over, they're constantly kicking their legs back and forth when you're diapering them. That's because they want to roll. They don't want to be picked up. That also will reduce colic. Colic is another sign of digestive disorders in children. If we're constantly spitting up, always irritated, most of the time it gets labeled as acid reflux, which it is not because they're not producing enough acid to reflux. This is a common issue as well. So it goes hand in hand. And the same thing in adulthood, when we look at Crohn's disease, ulcerative colitis, or any form of bowel disorder in an adult, remember your digestive system is a modified tube from start to finish. And generally, when we have an issue where we start digestion, which is in our mouth, we will have a resultant problem at the end of the tube, which is the bowel. But my question to most parents out there and adults that are listening as well, why would something that's exclusively designed to digest food, pull across hydration, and then move everything out that we can't digest, why would it just forget its job? That's a big question. Why would it just not want to do it? Or why would it do it too much? And it's a communication issue. We don't have a regulation issue. Furthermore, when we're looking at that in children, when a child doesn't get a normal vaginal birth, if they get C-section, which is a resultant, depending on what hospital you're at in Green Bay, it could be 37 to 38%. And depending on a provider, it could be 90 to 100%, depending on the provider, because they'll do a C-section on every baby. So when that happens, baby doesn't get a chance to pass through mom's birth canal. The birth canal is the most important meal you will have in your entire life because it sets up your microbiome, and you get your microbiome from your mom. And if you don't get a chance to process and go through the vagina, now we've disrupted our microbiome from day one. If we're pulled out via C-section or we're pulled out vaginally by a hand, forceps, or vacuum, now we'll get a traumatic subluxation of our upper neck, which then changes the way our ability to breastfeed. And if we can't breastfeed on mom, we've been able with technology to have pumps, right? Well, in the olden days, back in 18th and 17th century, they didn't have pumps. They had wet nurses around. So if a mom couldn't breastfeed, they had another person to help breastfeed the child with another person's milk. It's called a wet nurse. Okay. But now with common technology, we can use pumps. So we can still pump off breast milk, but baby still doesn't get that attachment to mom. So now we're taking a child and we're basically developing them to feed on a rubber nipple. And why I'm bringing this up is because that disrupts the first part of digestion, which is the mouth. So if a child is having constipation, especially as an infant, there is a very, very, very strong chance that there is a latch issue underlying as well. Because if the start of digestion is off, the end of digestion is going to be off.
Well, that, or if they're not coming to see a chiropractor and they don't get those subluxations corrected, then there's going to be those issues.
Yes.
Okay.
Thank you. That was awesome. That's exactly.
Thank you. Thank you very much. I do want to circle back, though. One question as you were talking about how to change a baby's diaper, which, by the way, those of you on YouTube, he was kind of demonstrating with a prop that he has as well. So if you needed that visual aspect, jump on YouTube to watch it. But you were talking about when you're lifting the baby's legs up, that's causing a lot of pressure in that low back. What are your thoughts on squatty potties for adults then? Because that's almost kind of doing the same thing, isn't it?
Different.
Okay.
Because a squatty potty is bringing your legs up in the front.
In the squat position.
In a squat position. So like we could go back to how we have medicalized of how women should labor, right? We're told to lay in a bed, lay on our sides. And the best way to actually birth, most women on here may know that, is to actually be in a squat position. Why? Because that is like the most straightest like way to exit. So when it comes to voiding, by bringing our knees up, that actually that straightens out the colon. So that actually makes it better. We can pressurize our core, our diaphragm, to actually get a really good push, a really good bowel movement to actually void the entire colon of what needs to be voided.
Okay, so it's really the angle At
It
which
is.
is
And I
okay.
mean, if you wanted to poop rainbow colored sherbet like the unicorn does in the Squatty Potty commercial, obviously you would have every kid on a Squatty Potty because that's what you want.
So funny.
It's the best
Because
commercial
remember, like
ever.
when you're sitting on the potty, you're sitting upright. All you're doing is you're bringing up the legs. When we're
Sure.
talking about changing a baby, we are bending up the low back and bringing
Yeah.
the legs up.
Mhm.
The fulcrum point is what's changing.
Okay.
Yep.
That is
So
helpful.
and I really would, this is a perfect opportunity to talk about squatting because we have basically lost our ability to squat
Mhm.
as like a human race. Our ability to squat is gone. Have you ever, like every parent has seen their child try to have a bowel movement and they squat. And even if they go to the corner to get away from you, go check them out. They're squatting. Like they're get down and they squat. Squatting is what helps birth a child. Squatting is what helps you defecate and actually take a poop. But what happens is that I've seen you do this with all of the moms with pelvic floor too. It's just an easy segue. Is if that test where you have them squat, and if they can't keep their heels on the ground when they go down, they cannot squat, which means they've lost tone in their pelvic floor. And most children can have this happen to them as well. And it usually happens around the ages of 2 to 3, where they start losing their inability to squat. And it has to do with pelvic subluxation
Yeah,
and their
you know,
ability.
I've definitely noticed that for adults, like, or if you're looking at a kiddo and you're like, I wish I could squat like that still.
Mhm.
So
Yeah.
this is where, you know, in our next episode, we're going to be talking about how kids are just super busy these days and
Mhm.
probably overscheduled. And while a lot of them are doing sports, it's like you start getting into these muscle patterns that take you out of these natural muscle patterns
Yes, they
of
do.
something like squatting. And so as you're talking, I'm even like, I know my daughter who's 8 still has a stellar squat because we will like play board games on the
Which is
floor and she'll
awesome.
sit there and squat and play. And I'm like, that's something I need to work on. I'm almost wondering if my 10-year-old son could even squat anymore.
Have
So,
them do it
yeah.
once. Just do the squat test,
Yep.
and if
Make
he
sure
laughs at you,
heels stay on the floor.
yeah, can you
Yeah.
can you just hit on that, like, please?
Yeah, I would say the squat is not just like getting down in a squat position. There is proper form that should be, but the biggest thing is making sure that your butt stays back, but your heels need to stay on the floor. Lots of times we're going to cheat and be like, well, sure, I can get in a squat position, but you are up on your toes, right? We can talk about cord and how that's the communication from the brain throughout, but it's really important that in that squat, your heels need to stay on the floor.
Mhm.
Mhm.
And pelvic subluxation affects that. So, like in little ones as well, the nerves that control the bowel are in the pelvis. They're nowhere else. They're in the pelvis. It's very similar to. I don't want to get into dual innervation. I apologize. I was gonna go into birth and women's uteruses and like I love pregnancy so much. So but in kids too, like there's dual innervation to the gut. But the biggest thing is the bowel, the sphincters that control the bowel are actually controlled by the nerves that are in your pelvis. And when a child's pelvis is subluxated, which is the triangle shaped bone, actually it's called the sacrum. If that shifts and goes forward or shifts and goes back, which common happens all the time during delivery, and then from the ages of 6 months to 2 years old, what are you learning to do? You're learning how to crawl, and then you're learning how to stand, and then you're learning how to walk. And you take about 500 falls between the ages of 6 months to 2 years old from a 1-foot distance. What's funny is the American Academy of Pediatrics will tell you that every time over half of those falls should be addressed with a pediatrician.
Hmm.
That's interesting. Nobody talks about that.
You just brush them off, look for
You just
blood,
brush 'em
everybody's
off.
okay.
Yeah, and it's that constant bombardment that we fall on our butt. Everybody's seen their kid fall on their butt. They just go, "Poof," and then they get back up. Well, as an adult, if I had you constantly falling on your butt 3 to 4 times a day, you'd be ticked. And most kids fall between 10 and 15, especially when they're learning how to walk. So now that subluxates through trauma of the pelvis and subluxates the sacrum, which now directly changes the communication to those valves. So now if I'm talking about a dam, I can't open the dam gate to let the water through. Sorry, it's not a swear word, but
I get it. No, it
the
works
gate of the
perfect.
dam. So if I can't open that, I can't let water through. If I can't control the valve that lets the bowel void and poop, now I'm just staying shut. And then what happens is that parents will be told that your child is losing the sensation to go to the bathroom. That is what you're told. Every parent. I've been in this for 19 years. That is what I get. Kids come in, parents come in with kids, they can't go to the bathroom. I've been informed by such and such healthcare provider that my kid doesn't have the sensation to go to the bathroom. Well, why is that? Because they are backed up and constipated, the sensors in the GI that sense fullness have been, what is it? They've been desensitized. If I take your skin and rub it nonstop, eventually you can't feel me rubbing. I've desensitized all the sensors in your skin. If I stretch your colon and fill it full of bowel material, fill it full of poop, now I can't get the sensations to void because I'm already full.
Mm-hmm.
And if I can't get the sensation to void, now my brain can't come back down and tell my GI to say, hey, open up this sphincter, and then let them know they have to poop, which then they can push out through that last sphincter, which we have control over.
Okay. So what's the solution here? Does chiropractic help to kind of open all the pathways back up?
100% yes.
Okay. What else would parents put in their tool belt to help ease constipation?
Well-
Magnesium. Magnesium is I joke when I say if everybody would have a little bit more magnesium in their life, they wouldn't be so stuck up, right? Everybody is so crabby, like just miserable. It's because they're full of shit.
Okay, stay on this for a second because there's like 12 different types of
Such a good
magnesium.
metaphor.
Magnesium lactate.
Okay.
Mhm.
All right. And then
We
is
have-
this something that you can overdose on? Is this something that, like, how much should somebody be taking?
This day and age, I don't think you can probably overdose. I mean, unless you are like mega dosing, but we are so deficient in magnesium that you would have to have like wheelbarrow upon wheelbarrow full of green leafy vegetables. And I know everybody loves their Brussels sprouts and their spinach, but it's not feasible. And so to think that we're getting magnesium in our daily diet and the foods that we're eating, we aren't. So we have to supplement. So we have to do it, and we really like magnesium lactate.
Citrate's really good as well.
And there's many different versions, but I always say like when if this is like a new realm for them, you pay for what you get, right? So if it's kind of like, oh, this one's on sale or this is really cheap, chances are it's the same as you eating sidewalk chalk, that it's just going to maybe make your color of your urine, pretty. So this is one of those things that you really just need to invest in for kids. A powder that you can stir in is really good. We have capsules that you can break open. You can even crush tablets.
Try not to do the magnesium gummies. They don't absorb. Most of the time with magnesium, a good way for you as an adult to look this up is I don't like sending people to Google, but this is actually a neat one. You can actually put in, like, let's say you have magnesium citrate. You can put in magnesium citrate into Google and just put in what is the absorption rate in my body. How does this absorb? Magnesium carbonate absorbs at 23%. That's the cheap stuff you can get at Walmart, and that's what's in most magnesium-containing things when they say there's magnesium in it, including a multivitamin. It's usually in there as magnesium carbonate or oxalate, which doesn't break down in the body. Even in the best clinical setting in a lab, it absorbs at 23%. So if it's $1, you just wasted 80 cents. Now, at this day and age, that kind of rings home for a lot of people. Like if I'm wasting 80 cents of every dollar, I'm not spending it. But if I know
people are getting supplements in order to feel better, but then ultimately if you're wasting your money and whatever you're absorbing is not doing anything, then yeah.
We see so many tablet and pill densities in adults on x-rays. Like you can literally see them. Like you literally can see them outlined in their colon. It's like, did you take a multivitamin today? Well, I take a multivitamin every day. Okay, that explains these 14 pieces that are in here because your digestion's super slow and nothing's breaking down. And if your multivitamin got to your colon and it's still not broken down, that is a horrible multivitamin.
Is this something that you guys sell in your office to make sure that people are getting reputable brands?
Yeah.
So there are some brands. I mean, we always test them ourselves, right? Our kids, we take that. But there is a standard, and there's a standard that we have in our clinic that we only do certain supplements. But I know that this is a really tough topic of well, I want to do what's best, and I can't read the label. I would say the first time, if you look at a label, if you don't understand what it is, chances are it's probably not something that can break down in your body. But we're always more than happy to look at a supplement for you, to look over to see if it's good, it's bad. Just like a big disclaimer, if it's coming into one of those tiered marketing programs or somebody on the internet is saying, prayed over your supplement, I pray over all of our supplements. We're a Christian office. However, I struggle with this because it's
It's
marketing and it pulls at your heartstrings, but they are not viable and they are not going to break down in your body. And so you're better off just sometimes skipping it altogether than to sometimes ingest those things that are sometimes can do more harm than good.
If your supplement can come from a whole food, you're so much better than getting a fractionated form of a chemical. So look for whole food vitamins. There are some really excellent whole food sources out there. We use Standard Process in our office. There's a few more out there that you can get at different pharmacies. Sorry, not pharmacies, but whole food like wellness stores. But make sure they're a whole food supplement. And when you're looking at a whole food supplement, it's not going to contain the 3,000 amount RDA. It's going to contain maybe 40% or 50% or 60% because it's coming to you in whole food. But you're going to absorb it because your body has to put it through it's got to go through all the processes that it does if you were to eat it, if you took it in a whole food form of a vitamin. So it puts your body through all the processes, which is exactly what it needs. It doesn't need a chemical fractionated form of what your body already uses, because what happens then is when you take that, the body, if it only needs 10%, it's only going to take 10% of that vitamin, that form, and let it go out to nature. It's going to let you poop it out if it's magnesium. But most of the time, when you take a whole food source, your body puts it through an entire process of breaking it down, and then it absorbs most of it because it's taking it through an entire process instead of just seeing the half-life of it and just pulling it in.
Okay. All right. That's super helpful. I think supplements is something so many parents freeze on and they're like, I don't know what to do. They can always just call and ask questions. I love that. All right. Let's circle back and kind of give parents a little bit more tools in their tool belt. So we talked about if somebody in their family is experiencing constipation, or I guess even the diarrhea side, right? Like, how do we get a healthy digestive system? Chiropractic, we talked about magnesium. What else? What are some other big hitters?
Proper hydration.
Yep. Hydration is a big factor of, are you drinking enough? Chances are like you might be having a bowel movement, but maybe if it's coming out in pellets, you're not hydrated enough, right? Like it should be a really nice poop that kind
Should
of
be a good,
just
it should be
glides
a
out.
good turd.
So hydration is super important. I know the food pyramid just kind of got, flopped on its head. But cutting out those sugars, lots of times if we have extra sugars, that will lead to softer bowels, and then we're probably not going to get everything voided. But our vegetables are really important. Our green leafy vegetables, that is definitely going to help the gut. That's going to give the gut some love in there. We talked a little bit about a probiotic in the last episode. A probiotic should not be used all the time. That's usually I'm good with all my supplements. I have my multivitamin and I'm taking my probiotic. Probiotic should be a set time. You take it to rebuild a proliferation, right? And it should have a prebiotic with it. So if you were sick, you took the antibiotic, you should take the probiotic 2-3 weeks tops. Then you need to stop.
Okay, so in general, people do not need to be taking probiotics unless they take something like an antibiotic.
Unless you've done something to deplete the good bacteria in your gut. So let's say that you got really sick and you didn't take an antibiotic. So let's say that you got E. coli, or like E. coli is extreme. Sorry. But let's say you got norovirus, right? Norovirus goes in and wipes out your colon. Nope. Yeah, I would definitely have you take probiotics for a month after that. The reason why is to help reproliferate your gut, but you don't need to take them after that. You could take them maybe once a week for maintenance, but unless you've had something come in and like completely detriment that basically destroy your gut, you don't have to do that. And it's been such a strong marketing thing to get everybody on a probiotic that now everybody takes them like they're multivitamins, and actually it causes more harm than good.
That is so good to know, and that's honestly going to save some families some money.
Majorly, it's such a relief to tell a parent like your kid doesn't need the probiotic. Really? Like, yeah, how long have they been taking it? A year? Stop, please, because their gut actually isn't back. There's study after study on probiotic exposure in mice, and what they found was that this is interesting. Can I take 30 seconds and talk about
Sure.
this study?
Mhm.
Is that okay?
Yeah.
So it's going to take a minute. So what they did is they did 3 sets of mice. They took a mouse that had they all had viral infections. One was on antibiotics, one was on antibiotics plus probiotic, and then one was on a probiotic, and then one was on nothing. And what they found was that when they finished up the antibiotic in the mouse that was actually on the probiotic with the antibiotic never actually got back to full intestinal probiotic amounts, like normal bacteria level. It got to 80%. The mouse that was on just straight probiotics did the exact same thing and got back to 80% and never got back to 100%. The mouse that actually was on 30 days of probiotics and then they stopped went back to 100% after 90 days. And the reason why was because the body actually was able to produce normal bacteria after it had already been reseeded, and then it could just take off and do its thing on its own. But what happens is we never let the body get back to its own production, maintenance, and feeding of those bacteria. Those bacteria need plant-soluble fiber. So like Dr. Julie had said, with food, fibrous vegetables and fibrous fruits are what feed those bacteria. So the peelings on your carrots, the peelings on your apples, the fibrous, dense fruit, that feeds those bacteria. They want that badly. That's why when you eat a whole apple, like you get a good organic apple, what happens? You usually take a pretty good bowel movement within like 16 hours. Well, you just fed all of that. And if you actually took the time and looked at your bowel, it was probably had a pretty good amount of peeling in it, which is a good thing.
Yeah. Super awesome. You guys are a wealth of knowledge. I'd love to just finish this episode just to open it up to you guys, because we know that you are specialized in prenatal, pediatric, chiropractic, obviously. What are some like unique services that you offer in your office as well?
Yeah, so a big part of our clients, our patients, are pregnancy patients. And personally, like, this is one of those things that I wish I would have known after I had my kids. And so I do it's called Empower Her. It's a core restore program. After moms have kids, our lady bits sometimes don't go back to where they're meant to be. And so I work with moms on bringing pelvic floor back up, repairing diastasis, really good core breathing, able that we can get into that squat position. So we do lots of core work with our patients in our office. We do nutritional programs, regimens. If you're kind of like, okay, I want to go all in, I really need to reset for this year. And so we can do nutritional programs.
We also do gut biome testing.
Yep.
That's not like a defecate, like poop in a box type situation. It's actually really easy to do.
You take it home. I get you started, but you take that home and you do that. So we can test your microbiome and to see, okay, do I have an overgrowth? Do I need to do a probiotic? Have I been doing too much of a really bad probiotic? So we can do those testings as well. And then sometimes people aren't ready for chiropractic. And we have a sound lounge in our clinic, and it's a vibroacoustic lounge. And so we all are made of liquid. We vibrate. Have you walked into Brittany? I'm sure you met somebody and you're like, ooh, I'm vibing with that person, or somebody else is like, ooh, like stay away.
Sure.
So we have a sound lounge. So it's a vibroacoustic bed that we set to different frequencies that can help to also de-stress the body. We have different protocols for parasites, migraines, just full relaxation, an entire neurological reset. And so we have that as an offering as well. And sometimes that's just a glimpse, because sometimes I think behind closed doors, if you've never met somebody, we can be kind of scary, or the thought of a chiropractor can be super scary. So you can come in, book a session in our sound lounge and come and meet us in person, that we're not so scary.
That's perfect, because I was going to ask what the sound lounge is, because I know that you are offering a complimentary sound lounge session for our listeners. So Thank you for offering that. So if you guys want to take advantage of that, or just chat with them about anything we've talked about so far, it seems like you guys are an open book and super knowledgeable, and we're just are willing to answer anybody's questions. So go ahead and contact them. We're going to put your website and everything else in the show notes. What is the best email for you guys if somebody wanted to connect with you that way?
Yeah, info at primefamilycenters.com.
Perfect. All right, this was a great episode number 2. We're only halfway done with you guys, so I'm really excited about that. Next up, we're going to be talking about our kids. Are they too busy these days? And what does overscheduling do to their developing brains? In our final episode together, we'll be talking about migraines and headaches, probably both in kids and adults. That's going to be a very popular topic, I know, for you listeners. So stay tuned. We have more coming up. If you enjoyed this episode, would you consider leaving a rating or review, or sharing it directly with a friend who could benefit from the information? We know that you're a busy mom or caregiver, and our goal is to make your life easier by bringing tips and tricks directly from experts into your earbuds. By sharing this episode with someone you love, you can play a critical role in helping to make their life easier as well. We appreciate your time and thank you for being a part of the Motherhood Alliance family.